Good morning and welcome. I'm Adam Sherley, Administrator here at Grundy County Memorial Hospital, and it would be an understatement to say how excited we are to finally be breaking ground on this exciting and amazing project. So let's just give a round of applause to say that we're finally at this point here. So I'm honored here today as we officially break ground for a new era of healthcare for Grundy County and our surrounding communities. As we celebrate the future of Grundy County Memorial Hospital, we are equally excited to celebrate our rich history, as it is today that we're celebrating 70 years that the hospital officially opened. And if you look right behind us, this is the original hospital. Quite amazing. So we're breaking ground for a building addition for surgery and imaging services, as well as the expansion of our lab. This project marks the largest capital investment in the hospital's history. These healthcare services are the only patient-serving departments that are located in space constructed in either 1952 or 1971. Each has experienced substantial growth over the past 5 years. This project will not only accommodate their current needs, but position us to be successful and serve our patients for decades to come while remaining competitive amongst our peers. There are 3 key groups of individuals I wish to recognize for their efforts throughout this planning process that led us here today. To our GCMH family, which includes our Board of Commissioners sitting up here in our front row, our GCMH Foundation, our medical staff, and our hospital associates. Your unwavering dedication and commitment has led to our collective success, allowing for this investment to be possible today. Thank you for your never-ending focus on championing excellence. To our project stakeholders, please take a moment to view your program today. We don't have enough time to list everybody off, but the list of partners in this endeavor represent many hours of work, collaboration, and vision. When we say we're growing together, we mean it. The level of local participation in this project demonstrates the value that our communities place on high-quality care and local accessible care in our communities. And finally, to our patients, this project is for you. We recognize that you have choice in where you receive health care. We're honored and humbled that you choose our hospital. Your consistent loyalty to this hospital is what allows us to offer a wide variety of services, and most notably, make an investment like this to deliver on our promise of first-class care for the communities that we serve. On behalf of our entire team, we appreciate you joining us today. And next, I'll turn it over to Todd Button, Chairman of the Hospital Board of Commissioners.
Thank you, and thank you all for coming today. Well, a few of you that are glad it's outside because I can't wear a mask and a tie at the same time. So difficult for this one. So yeah, like Adam said, I'm Todd Button, and I'm Chairman of the board this year, and I live rural Eldora, halfway between here in Eldora. On behalf of the Board of Commissioners, I want to express the pride we each feel today. This hospital represents so much of our rural communities, and this project represents the culmination of years of careful planning and deliberation. Our board members do not take lightly our responsibility as stewards of all that the hospital represents to our rural communities, for providing first-class health care, the economic impact that the hospital supplies as a key employer and a community partner. The prudent planning of past leaders has led us to incremental facility improvements over the past 20 years. As Adam mentioned, one is renovating this 70-year-old building, and the other one is the emergency room and the inpatient wing that was put in service in 2009. I want to assure you that today's board carefully considered this project, weighing the alternatives provided by leadership, which included leaving our surgery, imaging, and lab areas as is, which would not have solved our space and efficiency problems that exist, or renovating areas to modernize for today's needs, which proved difficult or impossible. Because of limited space, operating rooms finally moved forward with a building addition. An investment in new space proved to be the best option, an option made possible by strong hospital finances, very favorable long-term financing rates, and careful scrutiny of our project partners. GCMH mission statement is to improve the health of the people and communities we serve. Grundy County Memorial Hospital excels in serving our citizens today, and groundbreaking on this new building addition ensures that tomorrow's healthcare needs will be met for decades to come.
The hospital's journey over the last 20 years has not only been focused on its facilities. After all, new buildings and new machines aren't what drive the quality outcomes and award-winning patient experience that Grundy County Memorial Hospital is known for. The people here are what make the difference. But maintaining fresh, inviting spaces and access to the latest technology in healthcare have helped this organization recruit and retain some of the best and brightest to ensure that we can deliver on our promise of caring for our community. In recent years, along with Unity Point Clinic, we have recruited young, hardworking primary care physicians and advanced practice providers into our local communities and established a strong primary care network here in Grundy Center, in addition to our neighboring clinics in Parkersburg, Rhinebeck, Eldora, and Conrad. Maintaining accessible primary care in our rural communities, in addition to a deep desire of area residents to keep their care local, has allowed the hospital to not only grow existing services, but to develop new programs as well. For example, in recent years, we've welcomed 2 new general surgeons, developed and implemented an increasingly busy interventional pain clinic, and recently launched a senior behavioral health services program in an effort to continue to meet the needs of our patients within just a short drive from their home. As a result of all of these efforts, the residents of Grundy County and surrounding areas are not experiencing what many rural Iowa communities face, which is a lack of accessible, high-quality health care. In fact, what we've developed here is really the envy of many rural Iowa hospital administrators and community leaders. As a primary care physician practicing here in Grundy Center, the steps the hospital is taking with this building project means that my patients will continue to have access to equipment and services, resulting in timely and accurate diagnoses, in addition to access to a variety of visiting specialists and procedures. As the hospital's chief medical officer, I can attest that these efforts to modernize our facilities, in addition to our track record of excellent patient care, experience, quality, and a commitment to excellence, are a game changer in recruitment conversations with physicians looking to join our team. We will continue to ensure only the best for our patients. On behalf of our entire medical staff, thank you for supporting the hospital and for joining us here this morning.
Good morning. It's great to see everybody here today. I'm Craig Buskell, I'm the radiology team leader. It was about 20 years ago. I was working part-time on weekends helping out here at GCMH while also working at Allen Hospital. Film screen radiography was the only modality in the radiology department. I took my first professional x-rays in what now is the surgery area in junior high, of course. I could never have imagined standing here today. When I began here as department manager 11 years ago, we began to acquire new equipment and expand offerings in the radiology department, including leasing a new MRI. We were able to drastically increase the number of patients choosing our hospital for their imaging needs. It was in 2009 when our hospital was first recognized at the national level for the patient experience. An amazing testament to not only our updated facility, equipment, but the way that our team members made our patients feel like they were part of our family. The one outlier in our imaging department's patient experience continues to be the MRI machine. The hospital has not had a large enough space to be available to locate this piece of equipment under our own roof. It's been a dream of mine to locate this machine alongside our other imaging services rather than in the parking lot in the semi-trailer. And with today's groundbreaking, that goal is mere months away. The new building being constructed right here includes a new CT scanner, dressing rooms, a space for a new state-of-the-art MRI unit, which brings so many benefits to our patients. It means no outdoor walks in extreme weather. Both CT and MRI will be located much closer to the ER, the department needing to improve safety and efficiency. New types of exams will be able to schedule at our hospital as well, which is what I'm really excited about. I couldn't have imagined a time when our hospital's patient volumes would be at the levels they are today. They've increased from doing 10 MRIs a month 10 years ago to doing over 70 a month today. But right here we are, right on the cusp of breaking ground for a building that will place the MRI right about here. To those of you who choose MRI or GCMH radiology for your imaging needs, thank you. To our primary care providers who depend on our department's diagnostic capabilities, thank you. We are here because you've been here supporting us along every step of the way.
Good morning. I'm Jessica Eiler, Supervisor of Surgery and Ancillary Services here. Wow, I never thought that when I started here 17 years ago that I would be standing here today ready to break ground for a new surgery department. When I started here in 2004, GCMH was performing 25 cases per month. The types of cases that were being performed were knee scopes, carpal tunnel surgeries, endoscopy procedures such as colonoscopies and scopes of the throat and stomach. In September 2006, we did our first total joint surgery. Currently, we are performing 100 plus surgeries and procedures per month with 3 general surgeons, a GI specialist, cataract surgeries, foot surgeries, pain management services, 2 orthopedic surgeons that can perform a multitude of orthopedic cases such as fracture care, sports injury, and total joint replacements. The benefits of our new surgery department will include increased space. Our current ORs are about 400 square feet. The new ORs will be 700 square feet. We'll have 2 functional operating rooms, a procedure room to perform pain management injections, 10 pre- and post-op bays, a separate entrance to the surgery department for patient privacy, improved OR efficiency, increase our OR availability, attract new surgical services, and continue to capitalize on surgical excellence through providing quality care, improved OR technology, patient safety, and exceptional patient experience. All of this would not be possible without the surgeons and providers that choose to provide services for the patients in the community and surrounding communities. I want to personally acknowledge and recognize our surgeons and providers of the GCMH Surgery Department. Dr. Bartelt, Dr. Kalala, Dr. Mason, Dr. Van Buren, Dr. Burgett, Dr. Solomon, and I want to also thank these surgeons and providers that were able to break away from their busy schedules to join us today in person. Dr. Cooper, Dr. Wilson, and Dr. Barnhill. I cannot thank our surgeons and providers enough for being a part of this journey. And we are so grateful for all you do for the patients in this community and GCMH. I am so very excited for my surgery team to be able to have a work environment where they can continue to provide exceptional patient care and an outstanding patient experience. I want to thank the senior leadership team and the Board of Commissioners for having a vision and believing in the work that we do at GCMH. Your leadership and guidance have been the driving force for our success for many years. Lastly, I want to thank our patients who believe in us, support us, and most of all, give us the privilege to be a part of their healthcare journey. We know that they can choose to go anywhere for their services, but they choose GCMH, and we are beyond grateful for your support. Thank you.
Good morning. My name is Eric Wenzel. I am the lab lead here at the hospital, and we got paper flying all over. I am excited to be a part of this great project to expand the lab, radiology, and surgery departments in this hospital. When I started here 11 years ago, we were doing about 2,500 billable tests in this hospital. Today, we're doing about 6,000. So that can show you how much the lab has expanded. And because of this expansion and what we're doing in the lab, it's going to allow us to bring in new technologies to help our providers diagnose and treat our patients here at GCMH. Sometimes it's kind of hard for small hospitals to keep lab testing in-house. We have to send a lot of things out, and it takes time to get those results back. And with this new expansion, we're going to be allowed to bring in some of these technologies. And we already have brought in a few. When the pandemic started, everybody knows how important it was to have COVID testing done on the patients and to get this COVID testing done as quickly as possible so that we could treat our patients. At first, we had to send these tests out. Sometimes it would take a couple days for results to come back. But we were able to bring in the gold standard PCR technology into this hospital and provide these services for our patients. We were also able to bring in additional testing to test for GI and abdominal problems. Some testings that would take a day or two to come, we would have it to our doctors within hours. So that has improved the care at this hospital all the way around. With this expansion, we are going to be able to bring in more technologies and more testing to help our patients. We're able to service our patients better by even something as simple as phlebotomy. We're going to have 3 rooms that are going to be completely enclosed for our patient safety and allow additional family members to come in and help with the draws that we provide to the community. So it's a very important project. I want to thank everybody who is involved with this to allow this to happen for us. Thank you very much.
Well, that concludes our formal program for this morning. Just want to thank you all for your continued support and attendance this morning. We do have some some brunch available and coffee, and would encourage you to stick around and socialize with one another. And I would just ask if you are going to be participating in the shovel ceremony, if you could stick around, because we're going to begin that shortly hereafter. So thank you.